The reflex control of micturition is called as simply micturition reflex. Very simple to understand. See, when bladder keep on filling, it will be sensed by the sensory nerve S2, S3, S4 pelvic nerve. Then it will supply the efferent parasympathetic S2, S3 and S4 that will cause contraction of the detrusor muscle, relaxation of the trigone and internal sphincter, and you can micturate. This is simply micturition reflex. Yes or no? Yes. So that is why the reflex control of micturition is called as micturition reflex, but there must be enough amount of urine in the bladder. Only then it can be intense so that micturition can happen. You do not go to washroom every time whenever you feel like having micturition. So it is controlled by your higher center. So this reflex keep on coming again and again, but it depends on your own effort that you are facilitating it or you are inhibiting it. So what is micturition? So whenever there is stretch in the bladder, it will be sensed by the sensory nerve S2, S3, S4 pelvic nerve. Then again parasympathetic S2, S3, S4 will cause contraction of the detrusor, relaxation of the sphincter so that urine can come outside. Is this one clear? Now what is the mechanism of voluntary micturition? This is the reflex. But when you think only then you can go to the washroom, and when you have prepared time and place, and then only you will perform this act of micturition. So efferent pathway is what? As we know, when there is a filling of urinary bladder, there will be increase in the intravesicular pressure. It will stimulate the stretch on the bladder, and it will be carried by which sensory nerve? Of course, pelvic nerve S2, S3 and S4. Then it will go, it will send the impulse sensation to the dorsal column of the brain. And where cortex, which part of the cortex is sensory? Posterior central gyrus is sensory cortex. Then there will be desire of micturition. Then according to your will, you will do this you can perform the act of micturition. So this is the mechanism of voluntary micturition. Filling of bladder, increase in the intravascular pressure, causing stretch on the bladder, carried by the pelvic nerve, then dorsal column to the brain. In the brain, posterior central gyrus sensory cortex, then you will have desire of feeling micturition. Now you will send impulse from the motor area. You want to perform the act of micturition, so you will send impulse from the motor area. It will stimulate the parasympathetic stimulation S2, S3, S4, okay, and it will cause contraction of the detrusor muscle, the bladder, and relaxation of the trigone and internal sphincter. And also with the help of pudendal nerve, it can relax your external sphincter as well. It will cause the act of micturition. Very simple. If you try to understand, these physiology topics are very simple, but only once you have to understand. I have told you again and again that knowledge is very broad. There was a time when we don't have enough book, we don't have enough material, but now there is information overloading. Everywhere there are plenty of books. In our time, there was only one book, 𝗙cie and 𝗃. Now we have at least 15 books, which we know. We have so much matter on internet. So now the time is there to limit the knowledge, to concise it. Otherwise, we cannot compete with 19 subjects of MBBS. Because to do MD, we must have command of all the subject. Okay, so we must make it more compact. Okay, more compact. Only then concept become more clear, and you can apply in integrated manner with your medicine, your gynae, your physiology, patho, pharma, or no. Is this clear? This is the efferent pathway. Now, sometimes they ask you in the viva, are there any accessory muscle also during micturition? Can you help in the micturition process? Yes, by causing relaxation of the perineal muscle, by causing contraction of the abdominal muscle, descent of the diaphragm is helping in this micturition. And sometimes breathing is also, you hold your breath with a closed glottis. So these are, you can say, accessory muscle during micturition.